Should people with disabilities exercise like a regular person? Stay tuned and find out. It is Chris again, and today we are going to talk about therapy and describe the three most common types of therapy. Therapy, or exercising most people call it these days, is important for everybody. If a person has cerebral palsy, they should have therapy from a young age because it helps the individual to learn to do things as they grow up. With that being said, they say that a regular adult should work out 3 or 4 times a week. Does this include people with disabilities too? I think they should, because they usually do not work out during the day. I went to therapy twice a week for 6 weeks. You were asking, why did I quit going to therapy? Well, it was not my decision to stop. It was Medicare who said that I didn't need to continue to go to therapy. When I was 3 years old, my mom started to take me to physical therapy and speech therapy from DuPage Easter Seals. So, what is physical therapy? The therapist often works with a person on motor skills like crawling, sitting, standing, walking, and many other activities. A physical therapist also makes sure that the child's body is properly aligned. Sometimes the therapist sees that the child's body is getting tight, like their legs. So they could suggest that the child should see a doctor who could evaluate the child to see if they might need an operation on their legs or another part of their body. My therapist suggested that my hamstrings needed to be lengthened. That was the best thing that I could receive. I had physical therapy until I went to college. Without the therapy from DuPage Easter Seals, I would have to say that I would not be able to do what I could do now, because when I started, I couldn't hold my head up. Now I can type with the head pointer all day. This activity takes a lot of control and work on my part. I mentioned that I had speech therapy too. That sounds really odd, to have speech therapy if I cannot talk. Well, a speech therapist works on so many things like communication skills with others, eating properly, drinking properly, and these days finding a communication system that the person can use. A speech therapist also helps the parents with different things like suggesting ways to get the child to gain weight. A child who is not verbal often has trouble with eating. Talking and eating use the same muscles in the mouth. The therapist could suggest different types of food that the child could eat easier, or food supplements like Boost. Sometimes the therapist might suggest a feeding tube to help the child to gain weight. The speech therapist take on many roles depending on the child's needs. After a while, I started getting occupational therapy, which helped me to learn how to take my jacket off and do some other activities. Despite achieving learning how to get my jacket off, it took too much time to do it that it was not really practical to do. As the time went on, I stopped practicing, so I forgot how to do it anymore. If your child has to see several therapists, going to a place like Easter Seals that has many types of therapists will be really beneficial. The reason why I say this is because they work as a team. Although your child will see each therapist separately, the therapists will talk to each other and give ideas of what worked or what didn't work well. They work as a unit to get the most possible outcome for your child. If you are a parent of a child with a disability and you don't know if therapy would help your child, I have to say that therapy is the best thing that you can give your child. With all the advances they made with therapy, your child will achieve more than 10 years ago. I see kids walking because their parents started therapy right away. With new equipment, it is pretty remarkable. When I had therapy for 6 weeks a few years ago, I started using a treadmill that held me up straight. By doing it, I got my heart rate to increase. By working out more, I started to eat more and feel a lot better. So why did Medicare want me to stop going to therapy? It was all about money. They don't want to spend extra money if they don't have to. I am healthy, but down the road if I continued going to therapy, I would be in a better shape in the long run. People with disabilities have to take care of their bodies too. As the years come and go, the number of people with disabilities will rise a lot. If we take care of our bodies now, we will be saving money for health care. So we should fight for therapy so we could have a better life. Isn't it only fair for us? At Disability Awareness, we try to give useful information to people with disabilities and educate society. If you like this video and aren't a subscriber, please subscribe to our channel and share this video with your friends. Here at Disability Awareness, we do 2 videos per week on Tuesday and 1 on Friday. So we will see you on Tuesday. It's Chris signing off.